Good evening, Mayor. How are you?
I'm doing great, Rachel. How are you doing tonight?
I am doing well. I am excited to be back. It is April. It seems like the months are flying by before we know it. It's just amazing how fast the year is actually going.
Exactly. 2022 won't be here long, will it?
It will not. But the positive thing is because we've been busy and doing quite a few shows and doing other activities, it's exciting to actually be out and about and kind of, as they say, open again, doing some things. So I'm not sure if you saw, Mayor, but I just got back. I was in Vietnam for about 10 days and I just got back on Sunday. So I'm excited to be back, excited to share at another time some of the things that I learned, looking at some possible international trade and international commerce, and met with quite a few good people while I was there, including the U.S. consulate, the embassy, other chambers from across the U.S. were actually there with me. So it was a great trip. It was great to be able to go out again. And so it definitely some great things happening. I can tell you that.
I believe that's a long trip, though, right?
That's a very long trip. Very long trip. Yeah, it's about travel time. Travel time was a long time. To fly from here to Japan, because I was in Japan also, was about 13 hours or so. And so that was, and let's just say quite a few people know Rolesville. So quite a few people know Rolesville now, not California, but quite a few people know Rolesville, North Carolina now, which is always a plus for us. But excited for the show lineup this evening of who we have.
I am too. Always good to have Mike on. He knows a lot about the history of Rolesville. I always enjoy talking to him. And then we got a new guest, Leslie McMillian, and she has a real good story to tell on insurance. And I think everybody should have insurance. And if you don't have insurance, you could have a problem. And I think she's going to help explain that and how we can make that work for everybody.
Well, I tell you, I'm excited. I learned something new. I know we have Leslie coming on, and so I just so happened to learn something new, not necessarily about insurance, but just as we look at, she is a benefits, I call it the benefits guru of what it is that she does. But one of the things that I learned recently, and I always tell people this, I learn more on TikTok than I have in quite a few places. Right. But there was a person on TikTok that actually showed you how to go in and set up your Social Security to pull it up to see kind of where you are if you're thinking about retirement, what age you should retire, your Medicare and all of that, which is actually attached to it. And someone made I think it was maybe a 3-minute TikTok about it or less to show you how to go in and pull it up to see if you actually qualify, because that's the interesting thing. So I can't wait until Leslie gets on to talk about Medicare and talk about some of those things, because one of the things that, I saw people commenting on was they have more years to work until they can actually qualify for Social Security. But it was just interesting to see
it is
how that
exactly
works.
Right. And, it can be complicated. If it's something you don't do every day, it can be very complicated. It can be overwhelming of all the different choices and all the different things you can do and decisions you need to make. And I think that's why a lot of people kind of put it out of mind for a long time, is because of the complexity of it and all.
Well, and that's the benefit of having Leslie tonight to break it down, to talk about some key things that are coming up. And, pairing that off with Mike to talk about Historic Rolesville Society. And Mike has been on a couple of other shows that we've done, and he's talked about kind of the history of Rolesville and our Historic Rolesville Society and some of the cool things that he's actually found in Rolesville, which surprises a lot of people as far as some of the things that are here, kind of ties back to our history. And for those who are watching, I think I mentioned it one time before when Mike was talking, and I actually sent it to a mom group and I said, hey, if you're looking for like some cool information for your kids, if you're out in Main Street Park or out in some of the other areas, take a look at this, online that he did to talk about what he found, where he found it. Maybe you can create a scavenger hunt or something like that. So maybe that's something we can talk to Mike about. Maybe we can create
Yeah,
a scavenger hunt here in
exactly. And
Roseville.
exactly. And you know as well as I do, Rachel, when you start talking to Mike about history, it can go on for hours and hours and hours. And and that's the biggest concern I got is how we going to do this in 20 minutes. And,
Look,
uh, so let's bring them on, give them an extra minute or two, and see if we can get them started on it.
oh, there he is.
Hey,
Hey,
Mike.
Mayor. Hey, Rachel.
Look
Well,
at.
Hope you're doing well. Hope
yes,
you're doing
sir.
well. Gwen, I
Doing
hope you're
good.
doing well, family, and everybody's doing good.
Yes, sir.
I thought before we start, maybe I know a lot of people know you, especially around the chamber and historical society and stuff like that. And you've been in town for a while, but it may be some that's on tonight that don't really know Mike Bailey. So maybe a quick bio of who you are. Maybe describe, a little bit about how long you've been in town and maybe some experience around that.
Yeah, sure. Well, I'm Michael Bailey to the citizens and the public here around Rolesville. I grew up in northern Wake County on Strickland Road on a abandoned farm, and that's how I kind of got into metal detecting all the way back into the 70s. I just turned 50, so I was born back in 72. So I was metal detecting when I was probably about 5 years old. I grew up, graduated high school, and I served in the United States Navy from 1990 to 94. I did 2 Baltic operations and down south, down in South America. Actually had a metal detector on my ship. So when I was out actually in port, I would actually go out and metal detect. I've lived here in Rolesville almost 20 years. Well, I'd say about 18 years. My wife and I have been married 18 years. And, the funny part about the history part is, and a couple of people have heard this story before. My wife told me to take a hike, and it was in a good way. She knows I like the outdoors, and lo and behold, this is all the way back in 2011. And Gwen said to me, Mike, there's a beautiful granite pavement out in the woods that you should just go check out. And lo and behold, I did. And I kind of looked at the topography and the geographic or the geology of the area and the stream. And I said, this is really interesting. That land was to be sold to the Wake County public school system. And I said, well, now's here a chance to, I'll just go out there and run my metal detector over out here near Tom's Creek. Maybe some Boy Scouts had been out there. Well, lo and behold, this is almost how the society got started and all the interest here in Rolesville. The single most important artifact that I feel as a diagnostic artifact was a colonial period knee buckle. A lot of people have seen me in my colonial attire and, sometimes at the museum and also during the Christmas parades in July the 4th. So, I went back a number of times, literally over a period of years, and excavated. It was like a metal detection survey, and I marked out and mapped out all these colonial artifacts. And then I got in touch with the state of North Carolina with the archaeology branch, and I submitted all the documentation, the supporting documentation, GPS coordinates, and it was recognized as a North Carolina archaeological site. And I wanted to do that because, as you know, Ronnie, there's a lot of growth and development.
It is.
And fortunately, this particular archaeological site is on a stream bed, so it is protected, and it's on public school property. It's on a piece of land that won't be disturbed. So if there was a greenway trail that was put in the future, then maybe there could be a more in-depth archaeological look with some stratigraphic layers, because what we did was only
Mm-hmm.
the top layers.
Right. Before we jump too deep into some of the things you found and all, Mike, maybe a brief intro of what the Rolesville Historic Society is. Who can join? What do you do? And those type things.
The Historic Rolesville Society was started. We started getting back to in 2012. The town of Rolesville celebrated its 175th celebration, and at that time, I approached. I believe Brian Hicks was the town manager at the time. I said, "Hey, Brian, the town's having this 175th celebration. Would you like for me to maybe display some historic artifacts that have been found in the area?" And he said, "Yes." And when I did that, there were some Native American artifacts and some 18th century artifacts and some neat collection. And that's where I met Terry, Marcel, and Little, and other members of the public. There were a lot of people that were interested in seeing this local history. And that's how that seed got started. Terry, Marcel, and Little, who is the operator of the Little House Museum, approached me, and we kind of collaborated together. So Historic Rolesville Society was formed in 2017 as a 501c3 nonprofit. So it is open to the public. Originally, we have sponsorships for families, businesses, students. So anybody is welcome to become a sponsor. And Terry operates the museum, and HRS is, like, as I said, is a nonprofit. So we are a separate entity from the museum, although the artifacts and history is held there in the Little House Museum. That was 2017. We got off to a really big start and a lot of interest. A lot of people came into the museum, and a lot of people said, "This is a really hidden gem," and it is.
Right.
What I think hit us the hardest was the COVID part. Now, looking back over the past couple of years, people haven't been meeting in person and such. So be it. But we as with any growth, we want to grow HRS. The interest is there. We need to get back to having sponsors come back and some fundraising and such. We had a great sponsor, Hal Perry, a developer who gave us a nice amount of money to keep us going for an extended period of time. And that's our goal. One of my goals is to increase the social media platform. We do have a Facebook page that is updated occasionally. We recently launched a YouTube channel. It's Historic Rolesville on YouTube. There's a number of videos on there. Some of them are actually PowerPoint presentations. They run a little slow. There's not music to them. There's not a lot of animation, but they're still very informational. It's something that, if you're sitting around the house on a rainy day and you turn on one of these PowerPoint presentations, you can see some of the very intriguing old history of the artifacts that have come out of here in Rolesville.
Great. And anybody that wants more information, I think your email is scrolling at the bottom there. So as it come by, people go ahead and write that down and reach out to Mike if you're interested in history and all. And since we mentioned history, let's take a little walk through history on Rolesville. I think we were first chartered in 1837. You may have mentioned, but you mentioned the colonial knee buckle. I think the history of the area is much older than 1837. Don't you think, Mike?
Yes, sir. Yes. We have physical evidence, not only in documentation and old records and land grants and deeds, but when I say physical evidence, the Toms Creek site yielded a number of flat tomback buttons and brass flat buttons. We have in the Rolesville History Museum in the museum room, in one of the displays is dedicated to the Toms Creek site, and those artifacts cooking cast iron pot pieces, wrought nails. Actually, an intriguing find was actually cut scrap copper. And when I say cut scrap copper, even up in Jamestown, Virginia, everybody knows about the archaeology of Jamestown, and that predates, going back into the, 150 years prior.
Right.
But there was time periods that they were cutting up copper pots to trade with Native Americans, and for simple trade also. So there was a number of cut copper scraps that were found at the Toms Creek site additionally. Also, there were a couple of Native American artifacts that were found. An arrowhead was actually found using a sifter, and it's a true arrowhead versus a spear point. And that's another thing, that the museum has. We have a lot of Native American history. Much of Rolesville was farmland, and a lot of that farmland, some of it still exists and it's still farmed. But in the 1800s, 1900s, and up until 20 years ago, there were vast fields, and a lot of those fields, our citizens have found numerous spear points and Indian artifacts from the area.
Right. Well, Mike, studying the Rolesville history as you have, I mean, you've gone over a lot already. What surprised you the most about Rolesville history?
I believe some of the biggest surprises are some of the rarity of some of the artifacts that were found. There's two Spanish silver coins that were actually found here in Rolesville, and they may come up on a slide. But what's interesting is one of them is King Charles III, and that particular coin was minted between 1759 and 1788. That was a very interesting coin. Another coin was King Charles IV, and that was actually dated from 1802. And a lot of people know where the Main Street Park is. And very near the entrance of the Main Street Park there was a stagecoach stop. A lot of people don't realize, but 401 that runs through town was a stagecoach stop. It's hard for everyday citizens or people that move here to just drive down 401, but you're riding on top of a stagecoach road, and in the vicinity of the park was a stagecoach stop. So it's really intriguing to find that we're walking around in the same areas that the Native Americans did, the early colonists did, from the 1700s, the 1800s, the 1900s, and here we are today. Just one little interesting thought. I've talked with you before, Ronnie. There are certain features about Rolesville in the geology that topography has not changed.
Right.
And even today, even in the park system, you can walk some of the same areas and see some of the same geologic rock features that have been there for thousands of years. And they're somewhat unchanged. There might be some weathering that has happened, but I love Rolesville's waterfalls, the geology of the area. It's a hidden gem in northern Wake County.
It is, and if you love rocks, this is a place to be, right?
Rolesville rocks.
There's a lot of rocks out there for sure. I know you find a lot of this stuff neat, or you wouldn't do it. So give us one or two things that you found or about Rolesville that you would say really intrigued you to being very neat.
I think the flat buttons, because I'll go with flat buttons and coins, and I'll go ahead and say horseshoes in there too. We have found a number of horseshoes, and they are well preserved. When I say well preserved, they're in the museum. Horses and horseback and mules and oxen, but these horseshoes represent where these travelers and these horses went. And up and down Main Street, off near Granite Falls, primarily here, in Rolesville. And so it's interesting to think about those horseshoes. They tell a story. It's almost that when I say traceability, if you find a horseshoe, you're in an area where the past is and was and still is.
Right.
The coins, we have in the museum, we have coins from the 1700s, the 1800s, and the 1900s. Some of the flat buttons, which is really intriguing. A lot of the flat buttons, they were some of my favorites because they actually have quality marks on the rear of the buttons. Now, there's two different. Some of the 1700 buttons are plain. Now, some of the buttons from 1790 up to about 1830 have these back marks on them, and all of these buttons were actually imported from Britain. We have a lot of them. Some of them have back marks that say London on them. So, you think about supply chain issues that we're facing right now. You think about supply chain in the 1700s and the 1800s. There was, when I say global trade, there was trade happening, but it's interesting to think how those artifacts got here into Rolesville, because they had to have come into a port in North Carolina, put onto a wagon, and shipped hundreds of miles on trails and paths, and ended up lost and found right here in Rolesville.
Mm-hmm. Yeah, that is really intriguing there. Rolesville is an old community, and you've kind of described, age is back into colonial times, and like most old communities, history is not always good. So, what have you found out about Rolesville, I guess, would be, most concerning, or maybe things that people don't know about the history of Rolesville?
Well, it is documented in multiple papers and books and documentation that Rolesville, there was a slave market here. William Rolls was a slave owner, and Terry Marcellin Little at the museum, she has done extensive research on names and some of the trying to piece together this part of history. And so we have a lot of documentation that are listed at the museum. That part of history is a part of the history, not only here, but in the South. So it is known. Some of these artifacts are directly related to that time period.
Right.
I think it's important to be able to, for people to be able to see some of these artifacts from that time period, and what it gives you a view of what life was like. Eventually, Rolls went bankrupt, and he left the whole state. Terry Little, she's done a fabulous job of the chronology of William Rolls and how the town was founded in 1837. But again, prior to William Rolls being here, there were a number of settlers and families here, well back into the 1700s.
Right. I guess more in modern history, 100 years ago, I guess from what you talked about is more of a modern history. The town did have a large fire and burn. Now, I think we talked about this before. And I guess my history of kind of looking back on Rolesville, somewhere around 1910, 1912, Rolesville really dissolved. It became non-existent from a municipality town type perspective. And actually, we got a new town charter in 1941. So there's probably about three decades or more there that, really the town, if it existed, it wasn't much here. Mm-hmm. I guess, do you feel like the fire led to that lack of growth and shrinking, and some of the struggles the town had to keep up with times, up to about 20 years ago, Rolesville was not much here.
Mhm.
So how do you think the fire related to that, or do you think it did?
Oh, I believe it did. And actually, I believe I should check with our fire chief sometime, Mr. Privet, because right over there next to his building, that was in the vicinity of where I believe one of the fires was. And when I was out in that area, I found molten glass, and most likely, I would probably attribute it to that time that Rolesville's buildings burned down. These were wooden buildings. They weren't, large granite or brick buildings. That's why they went up in flames and lost it. I guess. You know, that's right before the Depression time. So you think of those losses, and then what you get into during World War I and World War II, and things were not the same.
Yeah, for sure. And I think it did. I often wonder what it would be like if we didn't have the fire. And what year was that? Around 1917, something like that, maybe.
As I recall, that roughly
Somewhere in
about
I was thinking it was in the teens. And from my reading, it was some pretty large buildings at that time in Rolesville. We're getting a lot of excitement around the 3-story building on Main Street, that's being built now. But that may not have been the first 3-story building in town. If you go back further, we just don't know, do we?
Mm-hmm. Well, and there's things that that could be discovered upon future development by accident. I think people should always kind of keep an eye out, whether there's a road being graded, or a greenway path, or even in somebody's backyard. There's been artifacts found in the back of people's gardens in their backyard. So it's history is here.
Right. Before we break up, one of the things I always enjoy hearing you talking about, and you shared a lot of your artifacts and all already, but what is Mike? All the stuff you have found, what do you like the most about the things that you found?
Part of it is preservation and the research. I love doing the research. Some of these flat buttons, I've gone back and done an awful amount of research and documented it, because we do plan on actually offering a book to the public, basically on a number of sites and the artifacts that were found here in Rolesville. So it's kind of like the 5 W's. You hear why, what, where, when. I think that's 5. And you're right. It's who lost it, why was it lost, where was it lost, what was it lost, when was it lost. That's something that I think about when I pick up a unique artifact. Some of these unique artifacts are, like I said, are some of the flat buttons, the coins, the square nails. Even we're going to be expanding the display in the museum. Instead of having an art room, we're actually going to expand some of the displays in the museum, so that plow blades, the horseshoes, there's a lot of artifacts that have not been seen. And I think the town, and including yourself, anybody that visits, I think when a picture is worth 1,000 words, and when you can see something in person, it means that much more. So we have some work to do at the museum to kind of expand some of the displays and exhibitions, but I believe that nobody will be disappointed when they see this history.
Yeah, and I think I can safely say this in talking to you over the past. These things you find, you don't feel like they're yours. You feel like that they really belong to the public, and you really enjoy displaying them, sharing them with the public, and somehow or another, whether it's through the museum or whatever, there always be, I guess, artifacts for the public rather than Mike Bailey's personal, collection. And and that really says a lot, Mike. I really appreciate that. One last thing I do want to touch on. You mentioned all the artifacts, which is tangible things that you find. Um, but I want to mention a little bit about the natural areas and the park system that we're trying to do. We got quite a bit of open land that we preserve, but also there's a lot of creeks that runs from Rolesville and stuff like that. A lot of open space, and I think it's a lot of natural artifacts out there where they're at or where they belong. You don't move them. You can't move them. They're, like you said, waterfalls and rock formations and all that stuff. And there's a lot of things that we have seen that most people in Rolesville can't personally see, and pictures don't do it justice. I try to take pictures of it, and it just don't do justice.
I agree.
You can't. I don't know how you capture it. I guess the only body to really see it is kids and hunters, because you see evidence of kids and hunters out there, right? So the kids and hunters probably know what we're talking about. But other than that, it's a lot of things. And one of the things I know, Derek Van Stegen and others, they're working at what they call the natural museum or the park museum, outside museum. What is your thoughts about that? Is that from your experience of being out there? Is it things out there that really would be kind of neat and fun for people to see?
Oh, most definitely. Derek, I believe I'm in full support. I think it's very intriguing. Every town, some towns have historical markers, others have private documentation that's out for the public to see and read. I'm in favor. It's an outdoor museum concept of pointing out whether it's architectural or geologic. There's a lot of really unique geologic features here in Rolesville, including the waterfalls and certain Rolesville batholith, the Pluton granite pavements, and also archaeological. There are archaeological sites, and I think people, when they can see something and relate to it in the area, it brings a little more endearment to the understanding of not only the area, but also the geology and the archaeology. It's science. It's intriguing. Kids love it. Adults love it. And I'm in favor of bringing that to attention to our citizens.
Yeah, and Rachel, you can pop back in if you get ready. I was going to see if there's any questions from the public. And Mike, like I said earlier, we could go on this for a long, long time. You always got so much to share, and you probably share just a very bottom of the bottle of what you have. And but I would encourage people to reach out to you, get to know you, maybe see some of the things you've got going on. And now that COVID maybe is getting us back out in the open, maybe you can set up some tents in some public places and show some of the stuff you got.
I concur, and I'm thank you for talking to me, Mayor. Same thing with you, Rachel. I was thinking, Rachel, you have such a pleasant voice. You're on TV, and you could also lead the radio, just because I've heard your voice in the background, and it's very melodic. It's very pleasant to listen to.
Well, Mike, I don't know if that is a cue for me to wrap you up this evening. Look, but hey, however it works, but I can't let you go yet. We have some questions for you, and I think this thing about a scavenger hunt in Rolesville is probably going to be key. So the first question we have is from Dot Wiggins, and she wants to know, do you do detection hikes outside of Rolesville?
Cool.
I have personally. I've on vacation. I haven't gotten a group together, But metal detecting is becoming a very big hobby. I mean, there are so many different groups, and there's actually people paying to go to certain farm properties. But right now, I haven't organized anything of a detection hike out of Rolesville.
That is a good idea, though.
That is a great idea.
That is a great idea.
Another question we have is, and when you mentioned this, the questions were rolling in, but the nanny service says, where are the waterfalls?
They are all over. When I say all over, if you think about the Granite Falls, Granite Falls, people go, oh, Granite Falls, that's just the name of the subdivision. Well, the subdivision, the developer got its name from the Granite Falls, and the Granite Falls are, it's a beautiful, small, flowing waterfall over a huge granite boulder, in a sense. I've up and down some of the creeks. There are other small waterfalls. Some of them have been pictured on Facebook on certain pages, but that's a good thought. Maybe we should start gathering some more pictures of waterfalls, because they are a feature of Rolesville.
They are, and I can tell.
Like I said before, it's hard to capture them on film. I mean,
Yes.
it just doesn't look the same as when you see them out there in person.
Even in Millstream Park, if you get off the path and walk down to the stream, there's some pretty small waterfalls there too that are very pretty.
Yeah.
Well, and another thing also, Mike, as if people go out on the Greenway trails and just kind of walk around and see things, the trails here are amazing throughout Rolesville, and a lot of people don't know that. And they're not hard trails to do when you think about a trail. They're very easily walkable. You can start slow and start with a small section of the trail, and then you can be adventurous and go as deep as you like. But also another good question we have here is asking, where is the museum from Carmen?
It is located on 201 North Main Street. And it was the Terrell home. It's one of the most, when I say it's obvious, it's a obviously old home site, and it's white, 2 stories, and it's on Main Street heading north, past the furniture market that was on the right. So it's about 4 or 5 houses down on the left, but 201 North Main. And it's known as the Little House Museum and Gallery. Actually, Terry, if her littlehousenc.com is her website for the museum.
And I'll make sure we drop that in the chat for you also. And they have great tours available if you contact them. Terry, the one thing that I will say is really nice about the museum, the exhibits rotate throughout the year. And as they rotate, depending on what time of year it is and also how it relates to history, could potentially determine what's actually going to be displayed in the actual museum itself.
Mm-hmm.
Right.
Excellent. Thank you so much, Mike.
Thank
Thank
Mike.
you, Rachel. Yes, sir.
Yeah.
Thank you, Mayor. Appreciate it.
And we'll have to go on a hike soon.
Sounds good.
We'll have to watch out for the bees that got us last time.
Snakes and bees, copperheads and wasps,
Yes.
yellow jackets.
Yeah.
And we did see a snake when we went out. I think it
We
was
did.
Mike. We went out on the trail, and we actually took youth leadership out on one of the trails with Mike. And of course, what do we see? We see a snake. And I said, okay, Mike, we're gonna leave the snake where it is. We don't want to look at the snake. We don't want to get close to the snake. But Mike was really excited. But I said, I don't think so. We're gonna just leave it where it is.
Well, that was
As
a
long
good
as you
day.
don't bother them, most of the time they don't bother you. So
That's right. That's right.
well, thanks,
Well, thank
Mike.
you so
Appreciate
much,
it.
Mike. I'm going to go ahead and put you backstage, and we're going to get ready, Mayor, for our next guest, which is Leslie. And I will say I'm quite impressed of looking at the time of being able to keep Mike when we talk about history.
I know.
You did very well.
I know.
So let's go ahead and bring Leslie on to keep things moving. Hi, Leslie.
Hi, Mayor. Hi, Rachel. How are
Hey,
you?
Leslie. How you
We're
doing?
doing great. I'm gonna let
Good.
you guys get started. We have questions already rolling in for Leslie, so I'm gonna go ahead and turn it over to you, Mayor.
Good, good. Hey, Leslie, good to have you on the show. I appreciate you taking a little time out of your busy schedule to do this. I think it's a good public service message, as I was saying earlier. I think everybody needs to know about this stuff. Before we jump into that, though, I know you've lived here since 2006, I think, but give me a little bio of who you are, and maybe in that process, how did you pick Rolesville of all places to live?
Well, I am originally from New England. I grew up in Rhode Island and Massachusetts, and I met my husband at a wedding, and he brought me to Washington, D.C., where we lived for 20 years. I have been doing health insurance and benefits since I was 5. That's my story, and I'm sticking to it. Then after 9/11, we kind of were like, what should we do? And I said, I can live anywhere. I sell insurance. So he called my bluff, and we looked at going down to Myrtle Beach. But given the fact that I love being in the city and like the opportunity to have some cultural environments, that was too far of a reach for me at this point. So we kind of drove into Roseville unexpected, and we're looking at different houses and just fell in love with it.
Well, that's great. I think you're the first story I heard that's picked Rolesville over Myrtle Beach, so I have to remember that. So, appreciate that. And been here 2006. I guess you've seen some changes in town.
I have, of course, we all have. When I first moved here, I said, how am I going to live in a town so small? Because I think there was like about 1,500 people, but we've grown, and it's been a wonderful experience. Our daughter went to Roseville Elementary, and we've always enjoyed living here.
Great, great. Well, I want to talk to you a little bit about, your specialty there and what you do. I know you see a lot of this stuff on these TV shows, these medical plans always selling on TV commercials and stuff like that. But give me what your thoughts are on kind of the present day environment with medical insurance type stuff, Medicaid or Medicare, those things, and some of your experiences you're finding today with that.
Okay. Thank you. Well, I think, first of all, I want to clarify that I am a benefits broker, as Rachel said. I basically stay on working with health insurance, both the under 65 individual market, which you can call Obamacare, healthcare.gov, ACA, and then, of course, Medicare, which is generally for those people that are over 65. What I've done is I work in that space, so to speak, and I work and help people that are looking at leaving their jobs. They might be leaving their jobs. They may be getting divorced. They may be moving into the area. And I help them, for the lack of better word, bring clarity to confusion. It's my slogan. And I think that it's really very clear that there's a lot of confusion on this, how you get the benefits, when you're eligible for benefits. They don't necessarily make it easy for people to make decisions. And what I basically do is I help people decide what their options are, explain the process for how they enroll in a plan. And a lot of people that are coming from group health insurance it's their first experience to have to make a decision about their health care personally. So it's somewhat challenging sometimes to get around those concepts, because they always had a health plan that would basically they just picked, and they basically had that plan. So now they have a bunch of different options that they have to choose from. So what I try to do is I make it into a educational process so they can learn from the big picture, which is what Medicare is and what healthcare.gov is. Then we start to streamline it and then talk about their particular coverage. I like to say I have a secret power in that I can understand a benefit statement or a benefit summary from a company pretty quickly. So I basically will go ahead and compare that plan, whatever plan they're coming from, with the plan options they have so that we're not missing any important pieces, because it really is all about is your doctor going to be in the network? Is your prescriptions going to be covered? And what is the cost? Those are the three most important things to most people in terms of what they are going to get covered. So I just try to make sure they understand and have an informed decision so they can make the best choice for them, because it's every person I talk to has a different situation. There's no one person that's cookie cutter. So it makes it both challenging and rewarding when I'm able to help people to make a decision that they feel comfortable with.
Yeah, I think you summed it up very well. That, it's a pretty significant group of people that works 30 years, 40 years at a company that has the group care or the group policies, and really doesn't think a whole lot about it. And then they reach this point where they have to leave the company for retirement or whatever. So what is, I guess, some of the key enrollments or some of the key points around when you get to a point of life, and it may not even be 65 retirement, but what are some keys that you need to trigger yourself to start thinking about this?
Well, I think the most important one is that you are turning 65. And generally, I think it's best to start looking at that. Believe me, I'm going to be at that special age next year, and I'm already getting marketing information. From what I understand from others, it's pretty overwhelming because you're getting calls, you're getting materials in the mail, you're invited to different seminars, and there's a lot of different things. So the first thing I would say is about 4 months prior to your 65th birthday, you need to start thinking very seriously about your plans, because the important thing with Medicare is there are deadlines. So with Medicare, you can sign up 3 months prior to your 65th birthday, the month of your 65th birthday, or the 3 months after your 65th birthday. And that is what we call the initial enrollment period. And there's no underwriting in terms of health insurance. So no matter what you've got going on, you're going to get covered. But if you don't sign up at that time and you don't have other health insurance, because generally if you're on the Affordable Health Care Act, ACA, you're going to lose your health insurance when you turn 65. If you're working for a small employer, your small employer may have a cost associated for your plan that might be more expensive than what a Medicare plan would be. So it might be in your best interest to change from an employer plan, and even if you're still working. But sometimes that's not the case. And if you keep your group health plan and you continue to work, you don't necessarily have to go ahead and buy health insurance when you're turning 65. But these are all very, it's important to understand them from the particular situation you're in. I think my brain is kind of like Pac-Man, so to speak, because I have to think about what is going on with that person and how does it work best for them. So there are certain rules, there are certain timelines, and I do a class called Medicare 101. It is on Zoom, and it's the first and third Tuesday of every month. And I basically break down what Medicare is, how it works, the plan options. I think it's at the bottom bullet at there. You can register online. And I think it really does resonate with people because I answer questions and we go over the different plans and benefits. And I think it's been really helpful for people to have that resource available.
Great. I describe myself as a passive Facebook person. In other words, I don't very often contribute, but I see things and somehow things magically pop up. And yours pop up a lot. The class Medicare 101. It may be because of my age. I'm not sure how that works, but the phones are smarter than I am. So I see that quite often. And it looks like it's a pretty good opportunity that, if somebody haven't seen that, to take a look at that. One of the questions I have about that, is that a one-time class or is that a series of classes?
It's basically it's a one-time class, Ronnie. It basically can be, you can view it once, but I've had a couple people have come back more than once. They might watch it when they're 64 or something. And then prior to when we get started working on their particular situation, it's a good refresher, so to speak. So you can come on every time if you want to. There's no limit to the number of times. Some people learn quicker than others, and some people like to have ask more questions. One of the things that I think that's important for you all to know is that my background was in the group health insurance market when I was up in New England and in Maryland. And when I came here, I looked at what I could do to make myself unique. And that's when I started working more with the individual market. But because of that background, I have a lot of experience and know a lot of different things about health insurance. So a lot of people call me when they're looking at their jobs and they're considering their plans, or if they're not sure what to do about their health plan, whether it's their group plan or their individual plan. And I just like to consider myself a resource to folks so that they can make more informed decisions. Because, you can go out on the internet or you can call a carrier and you'll get some information. But if you call that person back or you go back to that internet site, you're not really getting the resources that you might need to, because they're really not going to ask you the kind of questions that I might ask.
Right. And it's more than just medical. I mean, you have plans that cover vision and dental all in, I guess, in one group, right?
Yeah, I offer life insurance as well as accident insurance, vision, dental, long-term care, and annuities. One of the things that I think is important, and I'll just briefly touch on this, is that, a lot of people have a large deductible with the ACA plans. They're generally around $7,000. Well, I have a small accident plan that works really well. It dovetails with that. And basically, if you have an accident, it'll pay your deductible. And I found that plan because I was tired of people having to go on payment plans for accidents because they had to pay their deductible. So it really is a nice little plan, and it's quite affordable. It's on my website, which I know they're showing at the bottom. And it's a lot of people who have children in sports, as well as are maybe a little bit accident prone, have found it to be very useful.
Great. Sometimes when I'm watching TV, I see these commercials popping up about, I guess, supplement plans. What is a supplement plan? Why would you ever need a supplement plan?
Well, when you're looking at your Medicare options, you've got a number of choices to make and another option. So you're going to look at a Medicare supplement as one of your options. And you've got Medicare. And then on top of Medicare, you've got to find another plan that's going to pay what Medicare doesn't. Because contrary to public opinion, sometimes Medicare does not pay for everything. And so what I help people do is to find out which kind of plan works best. So a Medicare supplement plan is a plan that allows you to go to any doctor, and basically you pay a premium for that plan. And then you have a very small out-of-pocket for medical care cost. You have to add that and marry that with a prescription drug plan. Now, the other option, which you also may see on TV, are Jimmy Walker and Joe Namath and other people that are talking about Medicare Advantage plans. Medicare Advantage plans are maybe similar to what you already have at work. They generally have a network, either a HMO or a PPO, which is a network either where you have to stay in network with their doctors, or you have a plan that has, the PPO has somewhat of a doggy door. So you can go in or out of network. But if you do go out of network, you pay more in those costs, but you pay copays. Copays. Now, what's attractive about them is that because they call them Medicare Advantage, the advantage is you don't pay a premium for your health, that insurance. So it might be at no cost. And some of them now have some great benefits like over-the-counter medications, a coupon book so you can get those for free. They may have dental, they may have vision, they have discounts on hearing aids. So, as you're looking at your options, you need to understand what's the benefit of a Medicare Advantage plan versus the benefit of a Medicare supplement plan. Because sometimes you're looking at a higher cost for the Medicare supplement, but you might need some of the care services that they would provide as opposed to a Medicare Advantage.
Very good. I think I understand now. Through the it's pretty complicated, but you make it easy to understand. One of the other things, I think, I wonder sometimes. We mentioned some people may have been, on a group plan through their employee for 30, 40 years. But then you have a group of people that, had family plans, spouse and on the plan too. And they at point of life, they're not the same age. Is somehow you have to decouple those two things somehow. How do you go through that exercise of figuring out, one is on a plan, one is not on a plan, and decoupling type stuff?
Well, it's interesting because I was just working on a situation like that. The gentleman was turning 64 and his wife was 62, and he could pay $700 to keep her on his plan. And yet that's a lot of money. And we were able to look at the affordable health care options that are available for her. And so I basically worked on his coverage, which was to explain Medicare supplements, prescription drug coverage, and Medicare Advantage. And then in addition, I worked with the wife to go ahead and explain the Affordable Care Act plans and the various plans and services and options that were available. So there's a lot of pieces, and I think it's really important to understand it is extremely confusing as you approach this process. And one of the things that I think is helpful is to have someone, whether it's me or someone else, that can walk you through the process, but let you make your own decision in terms of what you're doing. I think that the important thing for me is you can always go to a carrier to talk about these services, but you're not going to be able to speak to that person after the sale is done and after you've enrolled. I don't charge for my services. They are no additional cost. So having somebody who can be a person that you can count on all during the year is something I think that is an important part of my job. Because things change and life changes, and it's important to have somebody who gets to know you. And I have to say, Ronnie, that as I've been living here, we've created a very nice life, and we've got a lot of clients and friends that we really appreciate. And I'm just very grateful for the opportunity I've had here in Rolesville.
Great. Before we wrap up, I know we talked a lot about Medicare, 65, retirement ages and stuff, but it's more, it's even include young people, may have a job that doesn't have group coverage or something like that. So it's bigger than just one age group, right?
Absolutely. So with the under 65 market, there's a lot of times you might need to enroll. You might need to enroll if you lose your job and you lose your health insurance, and the cost of that coverage is expensive. You also may have a baby. You may be moving into the area from another area and you need health insurance, or you may not have health insurance. You get divorced, or as you were referring to, a lot of kids are on their plans. I don't know if you can call a 26-year-old person a kid, but I have a 22-year-old and I still call her a kid. So when they're absolutely have to come off their health plan at age 26, they have the option, if they have a job that doesn't offer them health insurance. That's a key point of the affordable health care. You can always buy coverage on the affordable health care, ACA, but when you don't have insurance at work, there are benefits to being able to apply and get subsidies, the premium tax credits that the government makes available for people. And that basically helps reduce the cost of the coverage that you would pay for that care. So we would find out if you're qualified to get that coverage. Those are types of things. So, if you have a question and you're not sure, because right now there's a special enrollment going on for people that are between making $19,000 to $40,000. It just started on March 18th. It runs to the end of the year. So if somebody doesn't have coverage now and they don't have access to group health insurance at work, they're eligible for a plan. And I had a young man who broke his hand and needed health insurance, and I was able to put him on a plan with any waiting periods at a very reasonable cost. And that's one of the benefits of having the healthcare.gov option, the national health plan option, is that people can get health insurance. They don't necessarily need to go without. Some people have that opinion that they don't need it. Well, the bills can be quite expensive if you don't have it. And you alluded to that in the very beginning of the conversation. The other piece I think that's important to talk about real quick, because I know we're wrapping up, is the number of scams that are out there. People are getting calls. They did not call anyone. They did not send an email or answer an ad. And people just are randomly picking up the phone. I had a call the other day, and because I'm turning 65, that call came in. They didn't know me, and they were saying they could save me money. They could go ahead and control my costs. They can give me great benefits and great services. If somebody calls you regarding health insurance, Social Security, Medicare, tell them you do not wish to talk to them. Tell them that they should not be calling you, and you'd like them to take you off the list, because that is a scam. They are trying to get your Social Security number, your Medicare number, or other vital information. And I cannot tell you enough that this is a very big problem for especially the elderly.
Yeah, and I appreciate you mentioning that as a public service message, because the elderly people is some of these people, they target them the most. And, I appreciate that. One last question. Let's see, Rachel is back. I know we got a lot of veterans in town, and always like to get the veterans information out there too. Most time you think of veterans having their own, system, the veteran system for healthcare and stuff like that. From a veteran standpoint, are they completely covered by that, or is there better options for them sometimes also?
Well, I think there's some really good options. Medicare Advantage plans have some excellent options, and they basically will allow you to go see a doctor, because sometimes with the veterans programs, you have to go to a facility that might not be close. And if you have to do that, then that would be very difficult. So you can go ahead and see doctors in your own neighborhood and get care at a very reasonable price. Now, a lot of times we don't include prescription drug coverage in there, because they can get that at their medical facility. So there are a lot of services, and a lot of the carriers have some excellent benefits for veterans. And that's just a question of calling me up, or the numbers on the bottom of the screen, or making an appointment with me. And I do appointments either face-to-face or by screen share, like we're doing right now. So I work in throughout the state of North Carolina. So there's lots of options. And I think that I always call it the aha moment. As you're going through all this, at the beginning, you were really confused. But, once you get a sense of the information available and you understand it, then you're basically able to say, this is the Yellow Book Road, and this is the way I want to go. And it makes sense. And a lot of people say to me, or actually I say to them, your group health plan, or your health plan that you have right now, is better than what I can offer you. And I am certainly happy to tell people that, because sometimes they think they have to leave and they don't. So they're kind of surprised when I tell them that. But, if they're on a particular drug that's going to cost them a lot more money than if they go on the plan that I can offer them versus the plan that they have now, that's the best thing. And I want to always do the best thing for my clients.
That's good. Rachel, did we have a few questions for Leslie?
We do have some questions, Leslie, for you. And we have a lot of comments also from people that you have helped. But here's a question from Jennifer. And the ultimate question that she has is, how do you help them understand their coverage options?
Yeah. So this is a big it's important. Prescriptions are incredibly important, especially as we age, because we may be on a lot of different prescriptions. And Medicare is great, but the Medicare coverage has some big, there's some cost associated with Medicare in terms of if you're on name brand medications. And one of the things that I'm finding is whether you have a group health plan, an individual health plan, or a Medicare health plan, a lot of times you may find that a program like GoodRx, which you can get an app for your phone, will actually save you money on those generic prescriptions. They can actually be lower than the copay on your health insurance plan. And for name brand drugs, that can be a challenge because Medicare has a certain level of tiers, and the more expensive the drug, the more you're going to pay. And I think that having the app GoodRx on your phone or another app like that, when your doctor gives you a prescription, you can look it up on, while you're there, you can look it up on GoodRx and find out if there's a name brand or if it's a name brand and what's the associated cost. Because your doctor may not know how much Eliquis costs. And Eliquis costs $500 some odd. And if your plan has deductibles, you will have to pay a certain amount of that. So if there's another drug, and the best time to ask your doctor is, hey, this drug's going to cost me this amount, or some part of that. Are there any generics available? And I've had a doctor ask me to go on a name brand drug, and I basically said, you know what? I'd rather try the generic first. And if it doesn't work, I'll go with the name brand. Certainly not asking anyone to jeopardize their health, but there are ways to control those costs. But Medicare drug costs are always going to be a challenge, especially if you're on a lot of name brand drugs.
Well, I'll tell you, Leslie, there is another question from Kathy Aesop about that, which is very similar. And so I do want to say thank you so much, Kathy, for that question. She answered it in talking about what those options are. And actually the app, I'm glad you mentioned that because that is something that is a great option for you to install on your phone. And I do want to say, I'm going to show this screen again because we talked about it a little, and I know that we want to talk about the actual annual open enrollments for Medicare and for healthcare.gov, but just want to show that information because that's also helpful for a lot of people as they're looking at options and kind of what they can possibly get. And then also the information about purchasing the short-term catastrophic health insurance, the life insurance, an accidental plan, and dental and things like that. It's also great information for people who are looking. There's some questions, some more questions in here, and I was going through looking at them, Leslie, just to make sure we hadn't answered them already. I'm going to show this one from Dot about Medicare options that cover long-term care, or is it always separate insurance purchases?
Well, thank you, Dot, for that question, because I think it's really, really important. Long-term care is not covered by Medicare. It is an assumption that it is, but it is not. Medicare will cover a certain number of days for anyone that's getting care in the hospital or recovery in a skilled nursing. But if you're considered needing long-term care, that is a separate product, and that's based on the activities of daily living, because you may not be able to get out of bed, or you may not be able to get dressed, or you may be not able to even eat. And those are generally covered under a long-term care, or those are costs that are associated with the family having to take care of that person and perhaps paying those bills. And of course, those bills are not inexpensive. A good time to look at long-term care, if you're interested, is anywhere from 55 to 60, 70 years old. Obviously, like any insurance, it gets more expensive the older you are.
And we have a question from Trish that talks about getting a lot of information from insurance carriers, and should she contact you now? Does it cost anything to work with you? What carriers do you work with? And I would say, Trish, definitely reach out to Leslie and you guys can talk about that. We had her information available, and that way you can actually get those questions answered. But I did want to show it so that you all know that we do see your questions. And then also we have one here talking about, why should I talk with you when I can speak directly with your insurance, with my insurance company? of talking about what is the service that you offer, Leslie, and why would someone choose to work with you?
That's a great question. And I think, well, first of all, I go through an incredible amount of licensing and education every year. I have to get recertified every year with the various products, whether it's ACA or Medicare, so that I am working with those carriers. I work with all of the different carriers. I think most of the name brand carriers, I'm not going to say because this is an educational, but the blue ones and the red ones and the orange ones, that all of those, the ones that you'd see on TV, I can work with. I think one of the big reasons why is that, you're working for an employee of a company, and that person is going to do as best the job they can to help you at that moment. But you're not going to get to call Tom back because it's a call center, and he's not going to, the person that you are talking to isn't going to remember what was said the last time. When you work with someone like me, then there are lots of brokers out there that are very good at what they do. You're basically getting someone who's going to get to know you, who's going to understand that you have a particular concern about whether or not you can get dental with your coverage, or whether or not there's a cost associated with a particular drug. And I build on my relationships each year as we go through the open enrollment and people asking me questions. And I get to know them, their families, and what their needs are. So I think it's a little more personal than working with those carrier reps or the carrier call centers, because we get to know each other, and you can ask me a question and I'm going to remember when your birthday is.
We definitely appreciate that, Leslie. Thank you so much. I mean, there are a lot of questions. We had a question, one last question that we had from Dot, talking about, of course, we know COVID changed everything and looking at options, but the ultimate questions were living at home and unemployed, can they stay on your plan or will they fall off? And if your policy renewed, does that mean they stay insured? And that, of course, is looking at within COVID, the pandemic, and you have an older child who's not in college but living at home and unemployed. How does that apply or work with your plan?
Well, most employers will allow you a child to stay on your health plan until they turn 26. That is the magic age. That hasn't changed because of COVID. That's basically what they can stay. So you have to check with your health plan as to whether they're going to get terminated on their birthday or at the end of the month or the month prior. Generally, it's the month prior to turning 26.
Okay. Excellent. Thank you so much, Leslie. Mayor, great show. I'm going to bring Mike back on really quick. He's hanging in the background. That way we can wrap up, and then we'll show also some upcoming events that we have going on so that everyone is aware of some things, and then also talk about our next show. Mayor, how does that work for you?
It works good. Thank
Perfect.
you, Mike.
Hey, Mike, glad you could join us.
Yeah, that was very interesting with Leslie.
Thank you.
Yeah, we had two good guests tonight. Great guests, I would say. So thanks both of you for joining. I think it's educational for people listening, and you intrigued a lot of questions from everybody. So thank you very much for that.
And we always want to make sure, as people participate and engage with us, we try to get as many of your questions in as possible. And we also try to make sure that we provide information so you can follow up afterwards. But we do want to share with you, we have some events going on that we want to make sure that everyone is aware of. And, as we wrap up the month, we have going on next week. We have a couple of things, but just wanted to highlight some of those key ones. We have our Youth Leadership Rolesville, which I mentioned earlier. Mike actually was one of the participants who actually did a session with the students to teach them about the history of Rolesville. Their graduation is on Thursday, April 21st at 6 p.m. This program is a year-long program. The students have been in the program since last year. In August is when they kicked off. And so they actually have their graduation on the 21st. So we're really excited about that. And we'll be excited to introduce the new Youth Leadership Rolesville class, because that is something we do at the graduations, is we actually announce who is in the new class and kind of, as we like to say, present them to the community. We also have going on next Saturday, our Roseville Business Saturday. If you are a business and you are, well, particularly if you are a chamber member, you can participate in this event for free. You can register on the chamber's website, or you can reach out to Sherry Bauer with the Roseville Downtown Farmers Market. If you are not a chamber member, there is a small fee that is attached to you being able to participate. That fee is being directly donated to a nonprofit. None of it is coming to anyone. There are no expenses where we say we'll take the portion or the profit left out. We are completely donating 100% of any of the fees collected for participants in that event, which will be donated to a charity. And Sherry can tell you more information about that. And she can also answer any questions that you may have for that. And then, of course, Mayor, for our show coming up in May, I can't believe that, we have Tracy Dupler and Valerie Massengill, who will be on the show on May 12th, 7 p.m. Once again, we will be streaming live on Facebook, YouTube, and on Twitter. So make sure you can join in and actually ask your questions, engage with them. Our panelists love it. Our guest participants love it when you ask them questions and actually participate and engage with them. It makes it such an interactive session. Wouldn't you say, Mayor?
It does. It really does. And I really are thinking we get some really great guests coming along. Rachel, we've got some coming up next month, and just put out there for the public to know. Typically, I book these guests a half a year at a time. So I'm starting to book the second half of 2022. We already going to November is dedicated to veterans. We'll have a couple veterans guests, and then the last show month of the year, December, is always economic development wrap up with Michael and yourself and economic development liaison Sheila Sutton. So it's not that many shows left. Things are going, pretty fast. So
Yes.
If anybody would love to be on, reach out to Rachel, reach out to me. And if you got a good idea and you don't know who the guest is, reach out to Rachel, reach out to me, and we'll try to find someone that can do that. But been very exciting. We went into overtime tonight, Rachel.
We did, but it was great information. It's a good reason to go into overtime for.
Yeah, exactly. Sure enough. Thanks, Michael. Thanks, Leslie.
Yes, sir.
Appreciate
Thank you.
you guys joining us.
Really appreciate
Thank
it.
you, Rachel, for hosting. Great show. Thank you.
Absolutely.
Thank you, Rachel.
Thank you all so much for joining us. See you next month.
Bye.
Thank you.
Bye.
Good night.